Can pelvic floor dysfunction cause leg pain? Good question to ask. That's what this video is all about. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. So one of the things that people think about when it comes to pelvic floor dysfunction is, do I have incontinence or not? And if not, well then I don't have pelvic floor dysfunction. I've done a video on telltale signs of pelvic floor dysfunction. I've written many blogs on the subject of pelvic floor dysfunction and the many presentations it can have and many misunderstandings that people have. So we're not going to talk about that. But one of the things I want to bring to your attention is, just like any muscle in your body, pelvis has a lot of muscles that line in this bowl-shaped structure. They line on the inside part, outside part, and imagine you have your pelvis with your spine connected to it, and of course your legs are connected to the pelvis too. So there are a whole bunch of soft tissues. So we're talking about muscles, ligaments, tendons, connective tissue, nerves, blood vessels. These are all soft tissue. So anything but the bones are considered soft tissue. So just like in any part of your body, when there is an imbalance in the musculature, you can have trigger points. Trigger points are lactic acid buildup. That the reason they're called trigger points is because they're points that when you apply pressure, they can shoot pain to other parts of your body. So we know that the pattern of pain associated with trigger points, and there are muscles in your pelvis and the areas connected to your pelvis that when there's an imbalance there, they can shoot pain down the leg. So can they cause leg pain? The answer is yes. What you need to understand is pelvic floor dysfunction is not just incontinence. And that's the biggest mistake people make. Incontinence is a chapter of a book called Pelvic Floor Dysfunction. So a lot of times people don't, or even when you go see your doctor and you complain about leg pain, and what do? They run a whole bunch of tests maybe, they x-ray you maybe, and then they say, well, okay, go see a physical therapist or go see a chiropractor. The reality of it is that that's a trigger point coming from elsewhere. A great example is when you have sciatica, which it's not necessarily sciatica, it can be your piriformis muscle that has trigger points and shooting down. So if you have leg pain, the reason I want you to pay attention to this is don't necessarily think it's related to the leg area. It can be coming from the muscles connected to your pelvis, not necessarily pelvic floor. Thanks for watching. Take care.